A rudimentary national health care plan probably began in America with the Civil War. The National Library of Medicine began quite humbly with a few books in the office of the Surgeon General of the Army. And in 1836, the first catalog of books and library were being created to be offered. The books and journals were generally starting to go out on loan to physicians across the country. By 1895, the U.S. National Library of Medicine collection was the world's greatest medical library. In 1861, at the beginning of the war, healthcare was thrown into the war with the very extremely primitive approach that had been created because of necessity. 620,000 soldiers died during the Civil War. Two-thirds died of disease, not wounds. Doctors did not understand infection and did little to prevent it. It was a time before antiseptics and a time when there was no attempt to maintain sterility during surgery. During the 1860s, doctors had yet to develop bacteriology and were generally ignorant of the causes of disease. But the North and South started to build military hospitals. Between 1815 and 1910, there was no insurance coverage. However, voluntary fraternal organizations and mutual protection societies started to offer limited coverage for injured and ill members. In 1865, Louis Pasteur began work as a microbiologist and chemist and discovered the principles of vaccination, microbial fermentation, and pasteurization. Florence Nightingale, an English social reformer, began to save lives using statistics and became the founder of modern nursing. She demonstrated the value of good organization, cleanliness, and properly trained nurses in treating British soldiers during the Crimean War. Between 1865 and 1912, Joseph Lister, an English physician, learned to use Louis Pasteur's theories of microorganisms in terms of how they affected infections and became the founder of antiseptic medicine. The benefits of using his approach spread throughout the world. Between 1885 and 1910, the American Medical Association and hospitals began to grow and become powerful lobbying and research forces for doctors. Hospitals began to transform from poorhouses and religious infirmaries into modern institutions where complex surgeries could take place. The national health insurance issue goes way back to 1900 with Theodore Roosevelt and William McKinley when they both ran for the highest office in this country. In 1934, Franklin Delano Roosevelt offered national health insurance as part of his New Deal. Between 1945 and 1950, Harry Truman offered the Fair Deal and an opportunity for national health insurance. Lyndon Johnson, between 1960 and 65, promoted the Great Society and did, in fact, bring about Medicare and Medicaid. Between 1970 and 74, the work of Richard Nixon, then president, and of Edward Kennedy, a senator, to bring in national health insurance took place. Between 76 and 79, managed care proposals were offered by Nixon and others. In 1992, Hillary Clinton and William Clinton offered the Clinton Health Security Act. All of these efforts, however, were not successful. In 1900, the American Medical Association became a powerful national force. In 1901, the American Medical Association reorganized as a national organization of state and local associations. Membership increased from about 8,000 physicians in 1900 to 70,000 in 1910. Half of the physicians in the country were now a part of the American Medical Association. In 1901, the Flint Vehicle Factory Mutual Benefit Association was created, and this was a group of employers and employees who worked to create medical and accident insurance that was issued by a mutual company. The association provided benefits to General Motors workers in Flint, Michigan until 1928 when the company switched to a group health insurance. Life in America in the 1900s was a challenge. The life expectancy in 1908 for men was 49 and a half, and for women 52.8 years. In 1910, American hospitals started to become scientific institutions, valuing antiseptics and cleanliness and using medications for the relief of pain. The American Association of Labor and Legislation offered social insurance at their conference and pushed a national health plan. Medical departments developed within the military, and training for military medical professionals increased the determination to develop a national standard. In 1911, Montgomery Ward pioneered the first group insurance. It provided disability income coverage for its employees and the first instance of group health insurance in the nation. 2,912 employees were covered. In 1912, Teddy Roosevelt and the Bull Moose Party took on social insurance issues. In that same year, the American Association of Labor Legislation published a draft bill that would provide health coverage for all, modeled on similar plans in Europe, but the plan died with the coming of World War I. During World War I, there was much need to look at health care in terms of taking care of those that were injured in the war and because of an expanding industrial base. In 1915, the problem of sickness when working led to a concern about lost wages. In 1915, progressive reformers proposed a system of compulsory health insurance to protect workers against both wage loss and medical costs during sickness. In 1921, heart disease becomes the leading cause of death in the United States. Reformers now emphasize the cost of medical care instead of wages lost to sickness. The relatively higher cost of medical care is new and a dramatic development, especially for the middle class. In 1921, President Warren G. Harding signs the Shepard-Towner Maternity and Infancy Protection Act. And in 1929, a doctor proposes the first pap smears to detect cervical cancer, although the test is not widely accepted until 1945. This effort to look at women's health begins the process of identifying the special needs of women in the healthcare system. 1929 sees the Blue Cross Health Insurance Plan developing at Baylor University. 1,500 school teachers were covered for 21 days of semi-private room and board and hospital extras in that first year. It's the predecessor of our modern Blue Cross system. In 1930, the Depression changed priorities, with a greater emphasis on unemployment insurance and old age benefits. Social Security Act is passed, but it is omitting health insurance. California provided the first statewide health insurance, a Blue Shield plan, in 1939, which pays physicians as opposed to hospitals. In 1940, during World War II, wage and price controls are placed on employers. To compete for workers, companies begin to offer health benefits, giving rise to the employer-based system in place today. 1942 sees Congress passing the Wage Stabilization Act, which provided benefits to employers, which made it possible for health insurance benefits to not be subject to wage and income taxes. Employers now are directly tied to insurance and to providing this to their employees. Employer-based health insurance morphed into selling accident policies that included disability, death, and burial benefits. The precedent of businesses having a stake in the well-being of their employees is now well established. In 1950, after the successful public and government effort to end polio, federal responsibility for the sick and poor is firmly established. Many legislative proposals for hospital insurance are offered again, but the attention turns towards the Korean War. In 1950, Harry Truman tries for government health care. President Truman sponsored a health insurance plan, but it is blocked by the American Medical Association. In 1956, the now National Libraries of Medicine Act is passed, and it places into public law the beginning of a medical library association, which becomes the basis for the modern exchange of information regarding healthcare. Senators Lister Hill and John F. Kennedy, who later would become President of the United States, are the sponsors. In 1960, people become concerned about civil rights, especially the elderly who have difficulty affording insurance. There are now 700 insurance companies selling health insurance. There's a doctor shortage, and major medical insurance is in much concern about the high cost of medicine. In 1965, Lyndon Johnson brings about a change to the Social Security Act of 1935, amending it to include Medicare, which provides health insurance to people 65 and older. Medicaid is also administered by the states and offers health coverage to certain low-income and disabled populations. In 1970, President Richard Nixon renames prepaid group health care plans as health maintenance organizations, and it begins managed care in America. The effort to reduce the cost of health care begins as a serious attempt to bend the health care curve. In 1974, Richard M. Nixon resigns as President of the United States. His attempt to promote a national health plan dies with him. Senator Edward Kennedy, who was offering a alternative plan and had hoped to compromise with Nixon, finds that his efforts are also undermined. Federal health insurance policies, which looked like they would have taken hold, are now put on hold. In 1980, corporations begin integrating hospital systems. Overall, there's a shift towards privatization and corporatization of healthcare. Corporations begin to integrate the hospital system, which was previously decentralized, and many other healthcare-related businesses consolidate. Between 1980 and 1990, mergers and acquisitions accelerate with the healthcare and healthcare insurance community. Community hospitals join ever-growing networks, insurance companies merge with each other, and many acquire community providers. Insurers and hospitals join forces. In 1990, then President William Clinton and his wife, Hillary Clinton, worked towards developing a national health plan. Healthcare costs are on the rise at a double rate of inflation. Expansion of managed care has helped to moderate increases in healthcare costs, but is not enough. The Human Genome Project is on its way, and the United States also has an HIV and AIDS epidemic with a 60% mortality rate. In 1993, President Clinton's attempt with the Health Security Act ends up in failure. The main goal was universal care for all Americans. Congress, however, opposed the act with the help of insurers and other entities that were not ready for a national health plan. In 2000, Medicare is viewed as unsustainable under the present structure, and efforts are made to start rescuing it. It's also a time when employer-based systems of insurance are seen as not having a potential of lasting with the decline of employer-based support. The Human Genome Project is now in full-scale operation, and it's 2 years ahead of schedule. In 2006, Medicare Part D takes effect, giving seniors subsidized prescription drugs. Under George Bush, this is the largest expansion to senior safety since 1965, when Medicare came into being. When we look at the U.S. healthcare system at a glance, we see there are purchasers, which are made up of employers, the government, and private entities, and insurers, as well as suppliers and providers. And in a national system, all of these different entities need to integrate and work together. In 2010, an attempt is made to bring all of these entities into one working operation. The Affordable Care Act is an overall approach to expand access to coverage, and it requires most U.S. citizens and legal residents to have health insurance. It creates a state-based health benefit exchange system. President Obama signs the Affordable Care Act into law, and it includes caps on insurance profit margins, prohibition of health plans that exclude enrollees based on pre-existing health conditions, and a major expansion of the Medicaid program. The health insurance marketplace is created, where those without health insurance can shop for insurance at discount prices. Through state exchanges, a marketplace is opened up through a federal website. The problems facing modern healthcare continue to be chronic conditions that are not easily dealt with: alcohol and drug abuse, diabetes, heart disease, chronic lung disease, adolescent pregnancies, teenage STD infections, arthritis and activity limitations, obesity, AIDS, HIV, violence, injuries, and car accidents are all population health issues. In 2016, for the first time in decades, the U.S. life expectancy has dropped, with preventable chronic disease remaining the leading cause of death. The life expectancy of a male is 76 and of a female 81 years. Aging population boomers and inadequate attempts to promote population health efforts has created a chronic illness crisis. The Affordable Care Act encouraged disruptive innovation. Individual mandates, employer mandates, accountable care organizations, wellness programs, CMS innovation centers all disrupted the healthcare sector in a way that hadn't been done at any time in modern times. In 2016, Bernie Sanders, running for president of the United States, proposed Medicare for all, saying that health care must be recognized as a right, not a privilege. In 2016, the concerns that most people had were lowering out-of-pocket costs, with Republicans preferring a reduction in federal health care spending and Democrats preferring guaranteed health care coverage. President Trump signed the first presidential document on his attempt to make good with promises to repeal the Affordable Care Act. In 2017, the Republican-led American Health Care Act of 2017 is proposed. The Republican bill shifts Medicaid to the state to control. It replaces the Affordable Care Insurance subsidies with a tax credit. It does away with the individual mandate in the way that could lead to the market actually collapsing. It also creates a situation where the Medicare Trust Fund will end up being drained of its surplus sooner. It allows insurance companies to charge older people a lot more for their premiums, and it gives a huge tax cut to the wealthy. The major factors driving health care in the United States include cost, $3 trillion, an aging population, 79 million baby boomers, changing relationships. Consumerism in health care is an inescapable growing trend. Drugstore clinics. The United States currently has about 1,600 small clinics in drugstores, such as the CVS and Walgreens chains. That number is projected to increase to 3,000 in the next 5 years. Technology. Growing advances in medical technology will significantly impact healthcare. Technology raises the cost of healthcare. Opposing models. The current fee-for-service model is in direct conflict with the growing patient-centered or population wellness model. So as we look at the future, we're not coming to an end, but we're looking at more changes and probably much more controversy in the proposals that are being offered to fix healthcare in America.